Good morning. This is Dr. Bill White again with the American Orthodontic Society, and I'd like to just talk with you this morning about a multiple problem case. It's a very small case. I'm just going to show part of it, but just showing how many problems crop up with a case, and it doesn't look all that bad to start with. But when you get in there and try to correct all these problems, it is a pretty good problem to do this. So anyway, I'm going to start off with this young man who, let me see, I'm going to have to get over here and get our little dot going again. Very nice looking young man, but anytime you look at this fella, he had his mouth open. In other words, he was a mouth breather, and you could see he had his mouth open here nearly every time I saw the guy. Every picture, he was just breathing through his mouth. So that creates a whole host of problems within itself. In other words, if you're going to breathe through your mouth, you have to have your tongue down in the bottom arch down here. Then that causes the bottom arch to spread more than the upper arch, and so your maxillary arch is normally deficient in width. And this cuts down the amount of air that you breathe, and it messes up your airway, so it has all kinds of problems from that standpoint, develops like this. Now, most of the time when somebody is breathing through their mouth, they don't swallow properly either, and if they use a kind of an infantile swallow pattern like that, where they don't bite, then the posterior teeth, well, all the teeth, tend to erupt together more. And the more they get together, the further the chin drops away from the nasal area, and you develop a long third of the face here, which is very distractful from the beauty of the case. But anyway, this young man has a bunch of these problems. Plus he's got rotated teeth. He's got some closed bite, a kind of a cross bite. And let's just go in and look at the problems he has, and I'll try not to take too much of your time. And I'd like to talk to each of you just as if I were talking to you sitting right here, regardless of where you are in the world. This is fantastic to be able to have this ability here. Now here's another picture, just the same thing. Now this is the young man's models. I don't have all the slides on this young guy, but you can see he's got a terrific crowded problem. He also has a little vacuum problem that these teeth are kind of sucked in over here. And the lower teeth, the cusp, are kind of getting close to the outside, whereas your bottom, having your tongue in your lower arch is widening that upper, the lower one, but not the upper one as much. And so we've got a crowded problem, and we've got rotated teeth problems. We've got a little depth of bite. We've got a cross bite here for sure. So we're going to come in and put some blocks on his lower teeth. Now, putting these blocks on the lower teeth has a lot of things that are good in doing the orthodontics. In other words, it holds those in place. Excuse me. If you have a TMJ problem or something of that nature, this lets your jaw be free and frees up the jaw back there. And the free MJ problem tends to go away when you get the condyle off of the retrodiscal tissue back here. Just all kinds of problems come up. And I've got a problem. I get to talking and my voice tends to go away a lot of times. Okay. Now, if I come in here and look on one side of the mouth, here's where we put these blocks. And you see the lower teeth are getting widened out to where you're contacting with the cusp on the teeth. So we put this little thin layer of acrylic on here, and that makes the jaw easy to go back and forth. And if his jaw is being trapped back by this crossbite, you open this up, and that allows you to correct the crossbite, but also allows the jaw to move forward. And the condyle back in the back here will move away from this tissue if you've got a TMJ problem to start with there. Those things happen. So let me move on here and not take any more time than we have to. On the other side of the mouth, a very similar thing, but a class 1 relation, no problem there. Almost a crossbite right in here, but not. But this holds the jaw back a little bit, so when we move this through the jaw, will settle out. We also have a excessive curvus fee, and we want to bring these down and these up a little bit, and we will pick this up and level the bite out right in this area. So there's just a lot of things go wrong that you may not recognize right off. Now we look at the upper arch, and you can see the lateral teeth with a crossbite, and these blocks were on the lower arch, but they built this up enough to where we could bring these teeth out into that space. And that if he had a TMJ problem, that would have helped that also. Now look at the bottom. We've got some pretty badly rotated teeth. This cuspid is sitting in there like that. And we're going to need to rotate it around. And of course, the same thing here. Need to rotate this one and line this up in here. Now, okay, we start this. I'm not going to show everything about the case, everything, but most of it's just simple, regular, orthodontic things that we need to do. So we would want to put in a flexible wire here with some expansion in it, and then this wire goes in and catches that tooth, and we've bonded these little thin blocks on top of your teeth. That lets your jaw go back and forth easily and makes class 2 correction much easier. The cusp don't hold you off a position. So then when you get through, you can take that off and bring the teeth together there. All right, let's see. Over here, you can see the bonded block that we put in here. And open the bite gives us plenty of room to correct this. So we put a spring in here, bring this flexible wire tied to that tooth. This tooth will come through this gap, and this opens the gap for the tooth to come through. And we've got a little expansion loop back in the back of that. And this will straighten and rotate every tooth in the mouth. It does more than you actually think it will do. Okay, looking at it again, we've tied this arch wire. to this and bring that out, bring it over here. Now let's go on to, and we jump over. This is just showing you these little thin acrylic blocks, and when you get ready to take it off, you take a kind of a barrel burr and make a groove right down through the middle of this. And you'll have a gap in here. Then you squeeze one side against the other. This is just acrylic. Now don't put any composite or stuff like that on it, and you can pop these off quite easily, but they rarely ever come off when you're doing this. Now let's go on from there. We come back in and line this up, and we're getting it pretty close. And here at this point, the midline is pretty well lined up. It's pretty well class 1. We have put a larger arch wire in now, and we've straightened this thing out. This wire probably down like that, and it's bringing these teeth down, and it picks this up, and it pushes this, or tends to level the whole arch out right there. I'm using some double brackets up here. That's not necessary. You could go in with these wing brackets and do all of that. Now here it's leveling out pretty good, and you can see where we were to start with on the arch, and there's where we ended up. So we've expanded this arch simply with some rectangular wire, and as you expand the upper arch, if you don't do something about the torquing the roots, the arch will tilt out like this, and your lingual cusp will be lower than your buccal cusp. So as you expand the arch in this direction, put this buccal root torque in the arch wire, and it tends to bring the roots out. And if you need more force, you tie one of these large arches on here, and it'll expand anything. I've never run into an arch you couldn't expand with it. It didn't matter how old they were either. So you can do that, but you've got to put this buccal root torque to make the roots go with the crowns. Otherwise, the torque, if you left it alone, you torque the roots out, it'll bring the crowns in because they're moving in the air, whereas the roots are moving in the bone as you expand. So you need to expand with enough force to make it go out, and then you have to make the roots go with the teeth. It's a bigger problem than people think of. But look at the difference in this arch now, like that, and we went to that. So now he has got better airway. It brings the roots out, and hopefully we can get him breathing through the nose. It has so much more of a benefit to the person all their life if you breathe through your nose. Now look at the bottom arch. This has a little deformity in the, taking this picture, this is not caved in that far, but we're making room for the 12-year molars, so we've got separators in here, and we're rotating this tooth, which isn't the best way in the world, but this is elastic chain. Run over it, we put a little acrylic there to make it go under, and hook it to the tooth here. So as it closes this tooth back, it's going to tend to spin it in that direction. See, so this is rotating the tooth at the same time that it's pulling it back into the space that it has. Now this one, we've gotten it rotated, just lining up with this. And we, if you'll notice the wings, we have them touching out here, and that tends to bring this tooth back tooth, but it was this one. It was almost 90 degrees rotated. Now you could use our excuse me, our other method of going in here to rotate this. You could attach the rubber, the little plastic chain, bring it around the tooth, and come in and hook it over here. But you got to put something to keep it off. So we got a lingual button, keep it from sliding over the tooth. And that is probably the best way rather than this. But here we're closing a space on the tooth too. But that's rather minor. But you hook this elastic in there, put it around, hook it there, but don't hook it on the wire. It'll spin that tooth. Just so easy. It's the most efficient way to rotate any kind of tooth I've ever seen. So let's go on here. Now we're in pretty good shape here. We've got the arches leveled out, and I think this is the, don't have him brush it as good as I would like, but you just do the best you can with that. All right, another view from the side, and it's class 1. We've got the crossbites corrected. The lower arch, you see this tooth is almost 90 degrees would be here. This is not quite that. We're going to spin that tooth. This tooth is not near that much, but we're going to tend to bring it out to it. Of course, it's all that lined up, and we're expanding the upper arch more than the lower arch so that we put the cusp of the upper arch come down in like this, and this cusp keeps you from biting your cheek. If your lower arch goes out here and you've got cusp to cusp contact, you chew your cheek. So help me, I lived with one of those problems. All right, we'll go on to look at the difference in this lower arch now. And you see we've got this rotated almost all the way. Neither one of them are completely rotated, but we've lined this up. Now that other picture going straight back in here was kind of a defective camera position in that. And here is the young man, but this is just like we started with him, and we didn't get to go in, and I don't have all the finished pictures, but you don't need to have everything here for you to learn about the blocks that we put on here, the expansion of the lower arch caused by the tongue being down here. Just the tongue's presence pushes on these, makes these teeth go out, and they get hit in cusp to cusp. Then a lot of times they shift, and you'll have a crossbite, or you'll have a unilateral crossbite or a bilateral crossbite. And my voice is played out almost, but I thank you for watching. But there's so many things to learn and to do in orthodontics. I hope that we have some influence on orthodontics wherever it's heard. The world's in such a mess now, it's hard to worry about crooked teeth when there's so many other problems in the world. So I hope that we will be able to straighten that out as well as straighten our teeth out. Thank you for watching, and I hope you'll join our group and subscribe to it. So I'm going to close out here and stop our program.